the mind-body connection, I give several examples to families, and this is important when you're counseling individuals about anxiety. One of my favorite examples to teenagers is, the first thing I tell them is, don't believe everything that's in your head, okay? Because invariably, thoughts are going to come into their head, and they don't realize that just because you have a thought about something doesn't mean it exists. So one is, understand that every thought that enters your head doesn't really matter. But the example I say to the children, to enforce, these teenage children usually, you ever watch, this is the question I ask them, do you ever watch a scary movie? Ever watch a scary movie at home, by yourself, the middle of the night, with no one there? And then you ask them, what if you watch that same movie on the weekend, the Sunday afternoon, with the sun out and the family there? Is it as scary? And it's not. And they understand that. And this is the kind of thing in our busy society that we have to begin to rekindle. We have to rekindle the idea that we are a family and a bigger family. And that's really what's going to keep the world healthier, safer, and is going to have a positive impact on our economy. When I was doing a rotation at Babies Hospital in Columbia Presbyterian, a perfect example of the mind-body connection. There was a boy who had been in the hospital so long, and this is before the time of, these Emler creams that deadened the, when you were going to get a needle, before Broviacs, PICC lines. And if this child was on the floor and someone opens an alcohol bottle, he would writhe in pain. He would actually feel pain. The association was so intense. And, when we develop associations, the mind, we can either go with these associations or we can break them. Another favorite example of mine is when I talk to families about if they've had vomiting and diarrhea. What's the last food they ate? For example, if the last food they ate was Chinese food, then every time they smell Chinese food, they'd get nauseous. Even if it was caused by a virus, it didn't matter. And it could go on further. Maybe when they see an ad for Chinese food, they get nauseous. At some point, your brain decides, I'm going to cut this off. But if it doesn't, these associations last.